So you found out you're pregnant, congratulations, and now you're here for your first prenatal exam. So I want to talk to you about what to expect to happen at your first prenatal visit. So the first thing is paperwork, of course. So you're going to have to fill out a whole medical history about your past medical, surgical history, family history, all kinds of stuff. And that's going to be collected, and then you'll be brought back to the examining room. On the way back, they'll probably ask for your urine, and each time you come into the doctor's appointment, you're going to be asked for urine, and the doctor will dip that urine for protein and glucose at each time, and we'll talk more about why that is later. Then they'll bring you into the exam room, take your vitals, the nurse will take a brief history, and then the doctor will come in. And the first thing the doctor will do is talk to you and take a history, find out a little bit more about you, ask you about your past medical history, your past surgical history, past pregnancies that you may have had, gynecologic history, ask you about your social history, what kind of work you do, are you married, these kind of things. You can basically get to know you, looking really for risk factors that might affect your pregnancy. Once that's over, then the doctor will ask if you have any questions, and that's a great time to ask, those sort of initial questions about pregnancy. For some people, there's a lot of questions, especially first pregnancies. Other people, not so much. One thing I recommend about questions is you're going to find as you go about your day that questions will pop into your head. Unfortunately, when you get to the doctor's office, a lot of people, their brain just shuts off and they forget all their questions and they can't remember to ask anything. So I would recommend jotting those questions down so when you come in, you can remember to ask them. So once your questions are answered, then the doctor will do a physical exam. Now, unless you've had a pap smear very recently, you're going to get a full physical. So that means they'll check your thyroid, listen to your heart, your lungs, check your tummy, and then the doctor will do a breast exam as well as a pelvic exam that will include a pap smear and cultures. One thing a little bit different on this pelvic exam than what you may have experienced in the past is the doctor is going to be assessing your uterus to see how far along you are, but he's also going to be assessing the bony structure of your pelvis, really to make sure there's going to be enough room for when the time comes that we can get a baby out vaginally. And the doctor should be able to give you some idea of whether that's looking favorable or not. After the exam, the doctor will again ask if there's any questions. At that time, you'll be allowed to get dressed, and then in some offices, such as ours, there's an educator that you'll talk to afterwards, some not. There should also be a discussion about prenatal vitamins, what sort of lifestyle changes you may or may not need to make, and then there'll be follow-up appointments made. There'll be usually a 4-week follow-up appointment if you're early in your pregnancy. There'll be a blood panel, and they'll do a full blood panel, and we'll talk about what we're looking for on that blood panel at another time. And then also, there may or may not be an ultrasound ordered, depending on your situation.
Medtwice.com